Well, it is delighting that we're in the middle of summer now, and it's actually hot in the UK, which is amazing for me. But I wanted just to make a video just to say that I want to give you more information and a bit more of an in-depth description of what my disability is, what DMD actually, what it does, how it does it. So I made a little bit of a video clip that will hopefully answer a lot of questions.
What is Duchenne muscular dystrophy? DMD is a genetic disease that causes muscle weakness and wasting. There are over 30 types of muscular dystrophy, of which Duchenne is the most common and severe. DMD almost always affects boys. It is typically diagnosed in childhood between the age of 3 and 6. Dystrophin is a protein in skeletal and cardiac muscles that help strengthen and protect muscles during movement. People with DMD fail to produce virtually any functional dystrophin, which causes damage to and progressive weakening of muscle cells. This disease is irreversible and currently has no cure. Duchenne muscular dystrophy occurs at a prevalence of 1 in 3,500 to 5,000 live male births, so around 100 births per year in the UK or about 400 to 600 boys per year in the United States. Symptoms of DMD occur at a young age, with the average onset usually between 2 and 3 years old, and is typically diagnosed at around age 5. Affected children will begin experiencing issues related to movement such as difficulty in walking, climbing stairs, or standing from a sitting position. As the individual gets older, the disease continues to progress and muscle weakness in the lower limb spreads to the arms, neck, and other areas. On average, children with DMD lose their ability to walk and transition to full-time wheelchair use at age 12. Eventually, increasing difficulty in breathing due to respiratory muscle weakness requires mechanical ventilation support, and cardiac dysfunction can lead to cardiomyopathy and heart failure. Because of the continuous muscle wasting caused by DMD, quality of life is severely affected as the person gets older, and increased care and support is required with general day-to-day tasks. Weakness of the heart and respiratory muscles make this a fatal disorder as no cure is currently available. In the past, patients with DMD did not often live beyond their teens or 20s. However, advancement in treatments and supportive care have led to delays in disease progression and increased life expectancies, where now people are living into their 30s and even 40s. What causes Duchenne muscular dystrophy? DMD is caused by a fault, known as a mutation, on the X chromosome in the gene coding for the protein dystrophin, the largest gene in the human genome. Without it, muscles are easily damaged, and their strength and function is weakened. Males have an X and a Y chromosome, whereas females have 2 X chromosomes. Every boy inherits an X chromosome from his mother and a Y chromosome from his father. The gene that can carry the DMD mutation is on the X chromosome, so if there is a fault in the dystrophin gene in the X chromosome, females have another one to compensate for it, although if the X chromosome with the mutation is passed on to the son, they only have one, so this will cause the son to have DMD. Each son born to a woman with a dystrophin mutation on one of her 2 X chromosomes has a 50% chance of inheriting the flawed gene and having DMD. This happens in 2/3 of cases where the mother is a carrier. In the other 1/3 of cases, a child is born with DMD due to a new genetic mutation that arises in one of his mother's egg cells. In either case, DMD is always passed from the mother. DMD nearly always occurs in males, although in rare instances girls who are carriers of a DMD mutation can also be symptomatic. Is there a cure on the horizon for Duchenne muscular dystrophy? Because the dystrophin gene is the biggest gene in the human body, this makes it more difficult to find a cure. To give you some additional context, most genes are made up of 10 exons and 50,000 base pairs, whereas the dystrophin gene has 79 exons and 2 million base pairs. Exons are portions of a gene that are linked together to form the instructions for making dystrophin. Think of it as stepping stones across a river, and you need to get across it to deliver a message. If one is damaged or missing, then you can't finish getting the message across. So, because one or more exons are missing in the gene that produces dystrophin, muscles can't maintain their strength and structure. Exon-skipping therapies are a newer class of drugs that target the primary issue in DMD, a lack of dystrophin. As I mentioned earlier, dystrophin is made up of 79 exons, or portions of a gene, that are linked together to form the instructions for making dystrophin. Now bear with me, but I'm going to try and explain this as simply as I can. Exon skipping aims to force the body to produce shorter forms of the dystrophin protein by allowing it to skip specific exons of a patient's DNA. Ultimately, the dystrophin protein made will not include the mutated exons, leaving it incomplete. As hopeful as this might sound, however, this incomplete protein is still partially functional and may aid in slowing disease progression, but it isn't the elusive cure we are looking for. Although exon-skipping therapies are available to DMD patients, at the time of making this video, the true clinical benefit of these treatments has not yet been verified. Moreover, current exon-skipping therapies are only applicable for approximately 29% of DMD patients. With 79 different exons that collectively make up the dystrophin gene, mutations can occur in a vast number of places, which can inhibit functional protein production. This means that separate treatments would need to be developed for each of the 79 exons in the dystrophin gene. At the time of making this video, there are currently 4 therapies targeting only those patients specifically in which exon 51 skipping, exon 53 skipping and exon 45 skipping respectively are applicable, so there are still 76 exons or 71% of DMD patients left to treat. Speaking from experience, unfortunately talk about treatments and cures have been widespread for well over 20 years, and progress has been painfully slow, so being a realist, it's best to wait and see what happens before getting your hopes up.
So I hope that was somewhat informative, but I've answered some questions about what DMD does. And if there's any other questions you have, please leave it in the comments or to ask me on my social media. And if you got anything useful out of this, please give it a like and subscribe. It's really useful for me because it helps to get my videos out to more people, to get more people aware of what DMD is and what it causes, the reality, you know. I want to give a very clear, blunt description to you guys. I'm not going to make it sugarcoat it, you know, to make it all fluffy and nice. The matter of fact is that DMD is a terrible disease, and it's just worse and worse as you get older, so I can't be any more clear than that. But even though it is a terrible condition, you can still live a very good life. I'm very happy most of the time, but I'm always trying to do things, you know. I don't want to stay at home and mope around. And I hope that I can motivate others to get up and do something, you know. So anyway, thanks for watching, and I hope to see you soon. Take care and stay safe.